Hi, I'm Dizon. I'm a professor of medicine and professor of surgery at Brown University in Providence, Rhode Island. And I'm also the head and the founder of the Oncology Sexual Health First Responders Clinic at Brown University Health Cancer Institute. People think of sexual health as synonymous with intercourse, and that's not an accurate definition. And unfortunately, sexuality is not something we think about either. We're born with our sexual identities. And yes, they can change over time, but we're also born with an innate sense of what we enjoy, what pleasure feels like, what intimacy feels like. And it's not until that's challenged that we realize it's a really complicated concept. So, sexual health, as I try to explain when people see me with issues, was actually a multiple domain experience. It's everything from the feeling of sensuality to how one feels about their own body image to their experience of climax, orgasm, and the sense of satisfaction. So it's multiple things. And unfortunately, after a diagnosis of cancer and its treatment, every aspect is prone to being impacted. The issues with the therapies that we deliver is the impacts that they have. So just hearing the words "you have cancer" is already a shock and a trauma that we experience psychologically. And if you compound that with the aspects of treatment that actually require removal of a tumor in someone's sensual organ, like the breast, then there's a loss of something termed breast specific sensuality, which in over 90% of women was what brought them to the experience of desire. And then you go through the aspects of chemotherapy and of radiation and the changes to the skin on the breast, which affects sensation, and also the systemic side effects of medical therapy, whether that's chemotherapy or anti-estrogen treatments, which can lead to a sense of dryness in the vagina, which collectively is called the genitourinary symptoms of menopause. The major crux of it is that we don't ask these questions, or we shouldn't feel that these are questions that we're asking to fulfill some sort of perverse interest on what's going on with someone's sexual life. There are evidence based interventions that can actually improve the sexual lives of our patients and their partners. For example, vaginal dryness can be effectively treated in a lot of people with the use of vaginal moisturizers, but no one ever tells someone how to use those vaginal moisturizers. It's never written in the instructions that are contained on packages. For women who are actually treated for breast cancer, it's important to use it frequently, 5 times a week, and maybe even reapplying this 1 hour before planned sexual activities is really an important aspect. And then for women who don't respond to vaginal moisturizers, there are hormonal preparations which are not contraindicated, whether that be something called DHEA or dehydroepiandrosterone, or even vaginal estrogen. The totality of the data with vaginal estrogen does not suggest there's an increased risk of a breast cancer recurrence, even if someone has hormone positive disease. And then there are aspects of things we can do if someone is having pain with sexual activities, whether that be penetration or play. For pain that's localized to the opening of the vagina, there's a medication. It's lidocaine, and it's a watery, diluted form of lidocaine, which was compared to a placebo preparation and showed significant impact. So much so that when everyone was allowed to take aqueous lidocaine, 9 out of 10 women who were avoiding intercourse were able to have penetrative sex once more. So, a very quick fix to a very common problem. And then there are medications to help with interest. Some of them don't have that much data in women treated for breast cancer, but we're starting to accumulate that research now. What was great about this study that was led by Deb Barton is that she did correlative studies for women who are on either a low or a high dose of DHEA. And what she published is that there may be an increase in estrogen levels, but it never goes above the upper limits of normal of the assay. And specifically, if you look at estrogen levels for people on aromatase inhibitors, they're not increased. So all of this data suggests that this is a safe product, even for people with hormone positive breast cancers. I like to say during a talk on sexual health that cancer is a social disease, that the person who's impacted by cancer is not only the person who has to individually deal with the treatments that are being offered to her, but it does affect their partner. So breast cancer is complicated and it does change aspects of relationships. And it takes work to reclaim that because when we're talking about healthy relationships, it's not something that one can work on by themselves. Both people need to commit to this. And fortunately, I've seen many, many people where there is that commitment to not only help someone through the acute phases of survivorship when they're getting treated, but to transition then to more of a longer term definition of what it is to be a breast cancer survivor, even if or when that disease comes back. Yeah, I mean, I think it's very important that communities like the Breasties, online communities, even local communities, be that resource for people who don't know where to turn. And for cancer centers, just realize that your doc has his or her own agenda when they have a visit with you in follow up. And it's oftentimes they want to know that you're okay. They want to know that you're taking meds if possible. And they want to know that the side effects of treatment are being addressed. And that's really my main objectives. And so things about survivorship oftentimes are left out of that conversation. But someone on that team often has to pick up that baton. And that someone is someone you probably trusted and got to know very well beyond just the breast cancer when you were being treated actively, whether that's chemotherapy or radiation. That resource is something that everyone should hang on to because it is not the oncologist who is the best equipped to hear about issues related to sexual health. But in that cancer team, there may be someone you're more comfortable asking about, and that person can be your advocate.
Thank you so much. Is there anything else related to sexual health that you think is important to know before we close out?
I always think it's important, and I tell this to my colleagues, but it's really important for people diagnosed with breast cancer to know cancer does take a lot from somebody, and there's so much that you have to give up when you're diagnosed with cancer. But your sexuality does not have to be one of them.